Mr. Secretary, you've made a number of outlandish and frankly disturbing comments both before and during your tenure as Secretary of Health and Human Services. I want to draw your attention to one of those times. In a 2024 podcast interview, you suggested that Black children on ADHD medication should be reparented. You said every Black kid is now just standardly put on Adderall, SSRI, benzos, which are known to induce violence, and that those children are going to have to go somewhere to get reparented. There is a lot to unpack in that comment. I know that you've already answered several of the questions I was going to ask, and so I'm just going to rephrase them. Mr. Secretary, you've already admitted that you are not board-certified physician, and you've already admitted that you did not go to medical school. Have you ever reparented, or parented, I should say, a Black child?
I don't even know what that phrase means, and I doubt
just
that
a yes
I said
or no
it.
answer.
I doubt that I said that phrase. No,
absolutely
I'm not going to answer something that I didn't say.
You absolutely said it.
Oh, I'd like to hear the recording.
So to be clear,
it doesn't
sir,
make any sense. I don't even know what it means.
I don't either. That's why I'm asking.
And by the way,
so to be clear, you're not a doctor, you have no medical degree, and you have no formal medical training. You have never parented a Black child.
24 of the 26 HHS secretaries have not had medical degrees.
This is my time. And I say to the chairman, I want to reclaim my time. So you are not a doctor, have no formal medical training, and you've never parented a Black child, and yet you are suggesting that the federal government should take Black children away from their families and reparent them and send them off to some wellness farm instead of providing them with evidence-based
You're just making stuff up.
I am absolutely not making this up. Mr. Secretary, in your opinion, what factors should the federal government consider when reparenting a Black child who has been on ADHD or ADD?
I don't even know what you're talking about, Congressman. I don't know what you're talking about. I don't know what reparenting even means.
I don't either, but you said that.
I did not say that.
Mr. Secretary, for Black families in the United States, the issue of family separation is not new. Our nation has a long and painful history of separating Black children from their families. During slavery, Black children were taken from their parents and sold with no regard for their humanity. And after slavery, Black families continued to face forced separations through Jim Crow laws, discriminatory policing, and child welfare systems that too often assumed that Black parents were unfit. Even today, Black children are removed from their homes at higher rates than white children, not because of their greater harm, but because of longstanding bias and built-in institutionalism. For you to suggest that Black families are not capable of raising their own children is deeply offensive. Sir, you are the Secretary of Health and Human Services for the world's most powerful country, and your words matter. When you suggest that reparenting Black children, when you sow doubt about the safety of vaccines, and when you promote unproven statements that have no basis in science, you endanger the lives of everyone across this nation. Those children have parents, and to suggest that they have to be reparented is offensive.
I never suggested that.
Your words matter. When those words are careless, communities pay the price. When your words are imprecise, they create confusion. And when your words are dismissive, they cause real harm. So you don't have the pleasure, because of your position, to speak first and think later. Not in this job and not because of your responsibility.
I expect,
and the American people expect, that you choose your words with sincereness and with seriousness, the seriousness that your position demands. American lives are at stake, and it's time that you start acting.